Well, I'm definitely very excited to tell you about the program of Rise Vermont. And it was established actually, I think over 2.5 years ago now, where a group of community members got together to talk about how do we make this community healthier. And we established this vision of establishing healthy lifestyles. And looking at the data is that the obesity rate for adults and children were higher than any other part of the state. And even though the state of Vermont is either number 1 or number 2 as the healthiest state in the nation, when you actually dissect the rate of obesity, we actually were a standout in Franklin and Grand Isle counties. And so that was the issue that we were trying to fix. The story began with really putting it out there who might be likely candidates. We wanted businesses involved.
The reason I've become really passionate about Rise Vermont is that it relates to healthcare and it relates to physical fitness and people's health. And so to make something like this work, you depend on consistency. And I've got one of those few products that comes to people every single day. So it's like this particular weekend, I've got a person who writes to the newspaper about a local project, sidewalks, connectivity, getting people outside. And she introduces the subject of the letter by saying, Rise Vermont, is participating, this is what we're about. On Tuesdays in our publication, we have what's called Rise Vermont. It's a health and wellness page. And it basically embodies all the missions of Rise Vermont. And it's inclusive, and we devote 2 full pages of the newspaper every week to this particular cause. I've got a print and design shop that did the website, comes up with the name, works continually to come up with new ideas about how do you keep the message relevant.
We wanted to get our school systems involved because it all starts with children and how we impact their decision and healthy behaviors. And we wanted to get folks that they themselves had an interest overall in living healthier themselves. So it was really about building partnerships around individuals, organizations, municipalities, because if we wanted to impact policy, that would come from town leaders and the city leaders to make it part of their planning, their health planning for their municipalities.
One of the really cool things that came about a lot of these activities was if we're going to redo the streets, redo the sidewalks, and improve the walkability and bikeability of the community, why not bring an expert in to help us get this right? What was really nice about this was that we also incorporated 4 other communities actually, Highgate, St. Albans City, St. Albans Town, and Swanton.
It's been really exciting to have the schools involved in this activity as well. And when you think about children coming together, it's really about getting it into the curriculum so it becomes part of their day-to-day activities, not something that's special. We did have some special events with them to kick it off, but teaching children how to cook, or some children never had eaten lettuce before, and so how do you actually put that inside the curriculum and getting the children to taste it, and then children start going home and telling their families, their parents, that when they go to the grocery store, I tried this, it's really good, or we did it this way. So how you start influencing parents through children. The Safe Routes to Schools, we've beat our goal already, and we're not even into the full first year of implementation. Working with the school systems and working with the communities on walking and biking, getting families involved and getting children involved in school, that's really making this an incredible venture. With any program, especially a new program, evaluation is critical. So it's really important that you set up some key indicators at the very beginning, things that you want to do as part of your action plan, and getting some baseline data. And public health has been phenomenal of getting us some baseline data of whether it's the walkability, the safe routes to school, whether it's businesses and how many have wellness programs from the beginning to advancing over time. So I think it's extremely critical to make sure that you have good indicator to start with and then continue to advance those indicators so you're measuring success and you're measuring outcomes. And that helps you determine whether you need to change course or not, throughout this project. The reason that the hospital is involved is something like this in the community regarding population health is because our whole world is changing. You think about a hospital as a place for folks to come to for treatment, whether it's an emergency department or inpatient care. And really, if we want to advance healthcare outcomes, it's really helping the larger population to make healthier choices. So teaching them, how to eat right, physical activity, it might be sleep, stress reduction. So it's really important for folks to take more ownership of their own health. And in the end, it will reduce the overall cost of care because people are making healthier choices and there'll be less prevalence of chronic disease.